NCLEX-PN Questions and Answers 2026 with Rationale Mock Test, 30 Must-Know Questions. Question 1. A nurse is caring for a client with heart failure. Which finding should the nurse report immediately? Weight gain of 0.5 pounds in 24 hours. Pink, frothy sputum. Fatigue during ambulation. Pitting edema +1 in the ankles. Pink, frothy sputum is a hallmark sign of pulmonary edema, a life-threatening complication of heart failure. Question 2. The nurse is preparing to administer digoxin. Which vital sign is most important to check before administration? Blood pressure, respiratory rate, apical pulse for 1 full minute, temperature. Digoxin can slow the heart rate. The apical pulse must be checked for 1 full minute, and the dose held, usually, if it is below 60 bpm in adults. Question 3. Which of the following is a symptom of hypoglycemia? Extreme thirst, frequent urination, shakiness and diaphoresis, fruity breath odor. Shakiness, sweating, diaphoresis, and confusion are common symptoms of low blood sugar, hypoglycemia. Question 4. A nurse is educating a client on a low-sodium diet. Which food choice indicates a need for further teaching? Fresh broccoli, canned chicken soup, baked salmon, brown rice. Canned soups are typically very high in sodium and should be avoided on a low-sodium diet. Question 5. What is the priority nursing action for a client having a grand mal seizure? Place a tongue blade in the client's mouth. Restrain the client's limbs. Protect the client's head and turn them to their side. Administer oral glucose. The priority is safety, protecting the head, and maintaining a patent airway by turning the client to their side to prevent aspiration. Question 6. Which site is preferred for an IM injection in an infant? Deltoid, dorsogluteal, vastus lateralis, ventrogluteal. The vastus lateralis, thigh, is the preferred IM site for infants because it is the most developed muscle. Question 7. A client is 2 hours post-op from a thyroidectomy. The nurse notes the client has a hoarse voice and is complaining of tingling in the fingers. What is the nurse's priority? Offer the client a drink of water. Check the client's calcium levels. Assess for signs of airway obstruction and notify the provider. Tell the client hoarseness is normal. Tingling and hoarseness post-thyroidectomy can indicate hypocalcemia due to parathyroid damage or laryngeal nerve damage/airway edema. Airway is the priority. Question 8. Which type of precaution is required for a client with tuberculosis, TB? Standard precautions, contact precautions, droplet precautions, airborne precautions. TB requires airborne precautions, including an N95 respirator and a negative pressure room. Question 9. What is the first sign of a pressure ulcer? Blistering, non-blanchable erythema, skin breakdown, deep tissue darkening. Stage 1 pressure ulcers are characterized by intact skin with non-blanchable redness. Question 10. A nurse is caring for a client with a nasogastric (ING) tube. What is the most reliable way to confirm placement before use? Auscultating air bolus, testing pH of aspirate, chest X-ray, checking for bubbles in water. Radiographic confirmation (X-ray) is the gold standard and most reliable way to verifying tube placement. Question 11. When performing suctioning on a tracheostomy, how long should the nurse apply suction? 30 seconds. No more than 10 to 15 seconds, as long as the client is coughing, until all secretions are gone. Suctioning should be limited to 10 to 15 seconds per pass to prevent hypoxia and vagal stimulation. Question 12. Which lab value is most critical for a client taking warfarin, Coumadin, APTT, INR, platelet count, hemoglobin? INR, International Normalized Ratio, is used to monitor the effectiveness and safety of warfarin therapy. Question 13. A client is prescribed a clear liquid diet. Which item is allowed? Orange juice with pulp, chocolate pudding, apple juice, milk. Clear liquids are those you can see through. Apple juice, broth, and gelatin are allowed. Pulp, milk, and pudding are not. Question 14. What does the in the acronym RACE for fire safety stand for? Activate alarm, aim at the base, assist others, abstain from using elevators. RACE, rescue, activate/alarm, confine, extinguish/evacuate. Question 15. A nurse is assessing a client with a cast. The client complains of extreme pain not relieved by meds and pale, cold toes. What should the nurse suspect? Deep vein thrombosis, compartment syndrome, osteomyelitis, normal post-op pain. The 6 Ps, pain, pallor, pulselessness, paresthesia, paralysis, poikilothermia, are signs of compartment syndrome, a medical emergency. Question 16. Which position is best for a client with acute shortness of breath? Supine, Trendelenburg, high Fowler's, prone. High Fowler's, sitting up at 60 to 90 degrees, allows for maximum chest expansion and eases breathing. Question 17. What is the priority action for a client with a suspected hip fracture? Assist the client to walk to the bathroom, immobilize the leg, apply a hot compress, perform range of motion exercises. The priority is to prevent further injury by immobilizing the affected limb. Question 18. A nurse is caring for a client with a potassium level of 6.2 milliequivalent/L. Which is the most important assessment? Bowel sounds, ECG/cardiac rhythm, skin turgor, deep tendon reflexes. Hyperkalemia, high potassium, can cause life-threatening cardiac arrhythmias. Monitoring the heart rhythm is vital. Question 19. The nurse is teaching a client how to use a cane. Which side should the cane be held on? The weak side, the strong side. Either side is fine. The side the client prefers. The cane should be held on the unaffected, strong side to provide better balance and support for the weak leg. Question 20. A client has a DNR, do not resuscitate, order. The client stops breathing. What is the nurse's first action? Start CPR, call a code, assess for a pulse and notify the provider of the death. Ask the family if they changed their mind. A DNR means no life-saving measures, CPR, intubation, are to be performed. The nurse should confirm death and notify the family and provider.